Hi, my name is Dr. Joe Childs, and on this DVD today, we're going to talk to you about balance disorders, vertigo, and dizziness. If you're a senior, I want you to know that falls are the leading cause of accidental death in patients over age 65. And vertigo is the third biggest reason why people actually seek out medical attention. Vertigo, balance disorders, dizziness, lightheadedness, these types of conditions have challenged doctors for years. They've frustrated patients for years. And the reason why is there's multiple causes for these problems. And there's not very many good treatments out there. In fact, most of the medications that are given only work for the short term, and most of them have the ability to cause you to actually get worse over time. So what I want to talk to you about today on this video is a revolutionary, drug-free approach to treating patients with balance disorders, vertigo, lightheadedness, these types of things. Let me tell you a little bit about my qualifications. I'm a chiropractor. I've been in practice in Downingtown, Pennsylvania for 10 years. But I'm not only a chiropractor, I'm also a specialist in functional neurology. What that basically means is I not only treat the bones of the vertebral column, but I also treat the brain and central nervous system. And I do that using a drug-free approach. So we don't use any medications and we don't do surgery in our office. But we treat the brain and nervous system, and we help patients with these types of issues, balance disorders, vertigo, these types of problems. So what I want to do today is I want to sort of break this up into 4 parts. The first thing I want to talk to you about is the different types of balance disorders, the different types of vertigo that are out there, because there's a lot of them. There's a whole laundry list. The other thing I want to talk to you about is I want to talk to you about the cause of these problems, the hard causes versus the soft causes. I'll explain that. Then from there I want to talk to you about the functional neurological exam that we do in our office for these types of patients when they come in. And then lastly, I'd like to talk to you about the exact procedures that we do to help patients with these types of problems. And again, these are drug-free procedures. It's not just another medication. So let's start off with some of the different types of vertigo. Well, first off, you have, everybody's heard of it, you have vertigo. And you can have vertigo with spinning, you can have vertigo without spinning. We'll talk about that. Number 2, you have ataxia. Ataxia is sort of a clumsiness. It's like you have 2 left feet. You really just don't know where you are in space. Then you have what's called disequilibrium. Disequilibrium basically means that your balance is off. These types of patients that have this, when they walk down the hallway, they may veer to one side, they may bump into things. They certainly are not sure of themselves. When they get out of the car, let's say at the grocery store, it is a feat to get from the car to the grocery store. And if you have this problem, you know what I'm talking about. We see a lot of patients with these types of issues. Then you have visual vertigo. Visual vertigo is interesting because most of the time you feel pretty well, with the exception of when you walk into this large space. And when you walk into this large space, you instantly get this spinning, or you get this strange sort of queasiness feeling about you. Another one would be height vertigo. You go to look over a balcony at a hotel and you just almost get sick. Then you have car sickness. These types of people, they get in a car, they have any trip in a car really just affects their stomach, affects them. They may get nauseous, they may get some spinning, things like that. Another big one that we see in our office is Meniere's disease. Now, Meniere's disease is a problem with the inner ear. We're going to use this chart as we go along. But basically, it has been thought of as an autoimmune disease that creates some damage in the way the inner ear membrane functions, and it can cause dizziness. I mean, these patients get sometimes vertigo for 2-3 days. That really knocks them out, can cause them to be nauseous. It causes them to get some ringing in their ear, which is called tinnitus. They may also have some hearing loss, and usually they have those 3 things. Again, it's thought of that this is an autoimmune condition of the inner ear that brings this about. Then you have the sort of the vague complaint of dizziness or lightheadedness. Maybe you stand up too fast and you get lightheadedness. That's called orthostatic hypotension. With patients that just say they just don't feel right. They can't put their finger on it. They may turn their head real fast and their vision may get blurry. We just call that dizziness or lightheadedness. Again, there's so many of these. We're just going over a few. And then you have something called BPPV, which is called benign paroxysmal positional vertigo. And with this type of problem, basically what happens is you get these little ear rocks, or these otoconia debris, that sort of break off in your inner ear and float around in what's called the endolymph. And what it does is it irritates the membrane in there, which then sends signals into your vestibular system. So it's an inner ear problem. And basically what happens, and see if this sounds familiar, you roll over in bed and you feel dizzy for about 15 seconds, and I mean, it's real bad. Some people get nausea, and then it goes away. Or you're sweeping the sidewalk and you turn your head too fast, and bam, it happens. About 15 to 25 seconds and it goes away. Very common. Again, there's really not a big understanding of what causes that. They do know that it's an otoconia debris or this ear rock, but some people believe that it may have an autoimmune influence. So there's multiple causes, and when you look at these causes, you can break them down into hard causes and soft causes. Now, hard causes are actual things that you can see on MRI, things like MS, things like tumor, things like stroke, things like high blood pressure that's unchecked. These are hard causes that are causing these problems. Now, if you have vertigo, you have dizziness, I recommend that you get consultation and some testing done by a neurologist. Everybody with these types of problems that don't seem to go away, you should definitely get an MRI, get a CAT scan to find out if there's any of these hard lesions. But on the other side of the coin, a huge majority of these patients have what's called a soft lesion. We're going to talk about what a soft lesion is, but let me explain how it kind of goes. Basically, patients with soft lesions, they will go to their doctor. They may go to 3 or 4 doctors. They may get MRIs. They may get CAT scans. They may get some advanced vestibular testing where basically they get some warm water and cold water put in their ear to determine and see if it's an inner ear problem. And here is the frustrating part. Most of these tests come back normal. They come back, nothing's wrong. We cannot find the problem. They'll say it must be a central-based problem, which means a problem with the brain, but guess what? We can't see it. We can't find it. So you start really thinking that you're going crazy because nobody has an answer for you. People tend to think that you're making the problem up. They don't listen to you anymore. Or you go get some testing done and they find out, hey, you do have BPPV, which is benign paroxysmal positional vertigo, which basically means you got a little crystal floating around in your inner ear. They find that out, but the way they treat you is with medication. They give you meclizine or they give you an antivert, which is the same drug, and it works when you're taking it, but when you're not taking it, guess what? The problem comes back. It's basically like a sedative for your vestibular system. Vestibular meaning inner ear and cerebellum, that area. We're going to talk about that today on this DVD. So that's what happens. And the trouble is you still have the problem. So you have an inner ear problem, or you have a central problem, or you have a hard lesion. Okay, so basically this is where I come in. I come in when you go to your doctor and they can't figure out the reason. And they can't tell you why you have the problem, but you feel this way. Your balance is off. Because this is the key. Balance disorders, vertigo, they simply are not just an inner ear problem, and most of the time they're not due to a hard cause. They're not due to the tumor, the stroke, the thing that's really bad that you need to get medical treatment for. So this is basically where I come in. So what normally gives you good balance or good equilibrium? Well, it's a complex interaction between a couple things. Let's look at this poster. Basically, what allows you to have good equilibrium or to feel like you are centered or not dizzy is, again, a complex interaction between your inner ear. The inner ear tells you where your head is in space. If you move your ear right, left, anything like that. The visual system, your ability to see, okay? These things have to match up. If you turn your head to the right, your inner ear tells your brain that you're turning your head to the right. But is what you are seeing moving to the right? Does it match? We call that gain. The other thing is our muscle and joint feedback system. The information coming from our body tells us where we are in space. I'll give you an example. If you take your finger and you try to touch your nose with your eyes closed, you are using your muscle and joint feedback system. It's called proprioception. You know where you are in space. You close your eyes, you move your arm all around, you know where you are. You move your feet a little bit, you know where you are in space because there's constant input from these mechanical receptors that are in your joints. The biggest amount of these receptors are in the spine, and they reside in the discs and they reside in the ligaments. And so if you've got healthy ligaments and healthy muscle and joint feedback system, this information comes in perfectly.